You're watching CTOM TV. Knowledge is power.
So treatment.
Yes.
So the standard, what we do know about it is it's very susceptible to radiation therapy.
Okay.
Now there's been a bunch of studies that go back and forth on this, but from our data, where it stands today, radiation therapy is something that you would do typically in HPV-infected head and neck cancers, not so much in non-HPV or HPV-negative cancers, because radiation in the throat and the neck area is a really bad thing.
Okay.
Causes a lot of problems. You know, you need feeding tubes, swallowing, all kinds of issues there.
Mm-hmm. But if you have proof that HPV is involved in your cancer,
you can get a lower dose of radiation, palliative dose maybe, for example, and get
have better benefits.
And if you have an ATM mutation, it's even more beneficial.
Yes, that's right.
So the standard treatment is typically a platinum drug, chemotherapy drug called cisplatin, and radiation and surgery, of course.
Okay.
Now, in that regard, there's also something called proton therapy. And proton therapy is, it doesn't use ionizing radiation. It uses a beam of protons. And the benefits of that is with proton therapy, and there are a few proton therapy machines around. There's a few centers around now. The benefit of proton therapy is it has something, it increases the energy, it creates this energy peak it's called the Bragg peak. And this Bragg peak is an area of intense energy that typically occurs in the back or the posterior part of the tumor. And that's why proton therapy is good, is because it creates this Bragg peak in the back of the tumor. Right, as it's leaving the tumor, not necessarily as it's going in, but as it's leaving the tumor. So that is an important thing. So the studies have shown that proton therapy in head and neck cancers
with HPV.
Regardless.
Okay,
regardless. But it typically, yes, with HPV. Gives you the same benefits as radiation therapy, but much less side effects.
Ooh.
So, people need less feeding tubes and weight loss and so on. And so proton therapy is the way to go for head and neck cancers versus radiation therapy.
Okay, regardless of HPV status.
Yes.
Okay.
Or it may not be as beneficial without HPV positivity.
Got it. Okay.
So there was some studies a few years ago that looked at a drug, an EGFR inhibitor called cetuximab. And they included that cisplatin, radiation, and cetuximab. It's a monoclonal antibody against the EGFR inhibitor, epidermal growth factor receptor. And this is a common treatment in lung cancers. It's one of the first targeted therapies, or it's like the second targeted therapy ever that we came up with. It's great drugs for many, many reasons. The doctors and scientists first rationalized that since this HPV infection occurs mostly in this area of the basal area, that cetuximab and other anti-EGF therapies may be beneficial. So they did a lot of studies on that. Unfortunately, it didn't pan out, and it's actually worse if you have strains 16 or 18. So if you have either strain or 16 or 18, we don't know about the other strains yet. We just have data for 16 and 18. Don't use cetuximab. It actually reduces the ability of the cisplatin radiation therapy. So it's not a good thing in that case. And that's probably because EGFR typically is expressed in the cells, the epidermis cells, which are above the basal cells. So that might be part of the mechanism. I'm not sure. I'm postulating there.
Okay. But this again comes back to why we need to know the types, the genetics that we really need to know what strain or
exactly.
Exactly. Okay.
So the main thing that we look at when we see HPV is immunotherapy. And the reason is because so the studies have looked at basically P16 variants, or sorry, so the HPV-16 variant.
Okay.
That's what they did. So what they did was they got a bunch of people with head and neck. It was a checkmate study. They had a bunch of people with head and neck cancers, that were HPV positive they looked at the 16 and they gave the patients that were positive for HPV and negative for HPV the immunotherapy. And the immunotherapy actually worked for both subtypes, but it worked much better for the HPV positive. So definitely PD-1 inhibitors are really beneficial for HPV positive head and neck cancers, and I would assume most. Now, the reason for that is, once again, how HPV cancers occur. So they produce this high amount of viral antigens, so the immune system is primed and ready. And once again, they typically occupy areas that have high amounts of TILs, tumor-infiltrating lymphocytes, the CD8 positive cells. And they disable these cells by overexpressing PD-1 ligand. And so when you take a immunotherapy, a PD-1 inhibitor, you're reactivating these T lymphocytes, these TILs, tumor-infiltrating lymphocytes, right in the area where the HPV occurs. And so, it's a perfect vehicle for this.
So you get, again, more immune system activity and attention.
Right off the bat.
Right where you need it.
Exactly, yes.
Okay.
And then they produce a high antigen load. So they cause a lot of different random mutations, not necessarily in genes, but just throughout the DNA. And that really allows the immune system to recognize it and show that it's very different from, the other cells in our body.
Right, which lets it target it better.
Yeah.
Okay.
So immunotherapy, definitely the way to go.
Okay, with HPV-based cancers.
HPV-based cancers, yeah.
Okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.